It's probably too dark.
Well, it looks like the stream of people entering has stopped, so we'll get going. So welcome to today's Friday rounds. We are on the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The City of Calgary is also home to Métis Nation of Alberta Region 3. My name is Alim Barwani. I'm the lead for public policy and partnerships for the O'Brien Institute and the director of public policy and strategic partnerships for the Indigenous, Local, and Global Health Office. We have an excellent workshop today that is being recorded on writing policy briefs with two supremely talented policy influencers. We will put their long bios in the chat so that I talk less and we get to listen to them more. Dr. Suzanne Tuff is a full professor here in medicine and is also Max Bell Burns Policy Fellow. Her research has been groundbreaking, influential, and generational in its impact in the areas of maternal and child health. Nancy Reynolds is a former executive in the Ministry of Health and Social Services, former executive for PolicyWise, and now the principal consultant with Sterling Lifestyle Solutions, and is a Max Bell Burns Policy Fellow. And I'd like to thank the Max Bell Foundation for their endless generosity, which included connecting me with Nancy last year, for which I was grateful then and continue to be grateful to this day. At any time you are struck by inspiration, you can ask your questions using the Q&A box. I will then pose those questions to our speakers at the start of the Q&A after their presentation. You can also private message me if you feel more comfortable sharing questions privately. If you have any general questions about these rounds, you can contact iph@ucalgary.ca. Over to you, Dr. Tuff and Nancy Reynolds.
Thanks very much, Alim, and good afternoon, everyone. We have just hit afternoon. So I am going to begin. As you could tell from the introduction, I'm really the policy wonk in this group, and Suzanne is. I'm just making sure I've got my. All of a sudden, this is not working for me. We had it all set up, and now it's not working. I don't know why. Sorry about that.
That's okay, Nancy. Are we just trying to do the share screen right now?
Yeah. It says I'm screen sharing, but my screen is not there.
Mm-hmm. Give me 1 second.
I don't know why. I'm just gonna. There we go. Let's try that again. It says I'm controlling. There we go. Not working quite the way it should, but hopefully it'll work. So, I'm going to spend the first part of our time together today talking a bit about the public policy process and why that's important in writing, in knowing how to write policy briefs and the information that you contain within your policy briefs. So, we're going to look a little bit at broadly what the public policy process is, consider a little bit what the role of evidence is, because at the end of the day, the evidence does not reign supreme, sadly. Some thoughts on preparing a policy brief, and then Suzanne's going to lead a bit of a discussion using a sample policy brief that we did for the O'Brien Institute on the topic that our fellowship was all about, which is about natural supports. I should say that in discussing the public policy process, this actually is very much just a very high level touchstone introduction. One would hope that it might tweak your interest in better understanding the public policy process and give you a few ideas for consideration, but to think about future opportunities to do more work in that. Oh, this is still not doing what it's supposed to do, sorry. I think, Liz, I'm going to need you to move it. It's just not advancing and I don't know why.
No problem.
Thank you. So in looking at, so what is what's policy making? First of all, it is more art than science, and that's really important when you look at the role of evidence in policy making. There's not much about policy making that's purely rational. It is frequently highly unpredictable, but at the end of the day, hopefully it reflects societal values. These are important pieces to keep in mind as you're writing policy briefs. Again, we often think that the evidence should reign supreme. We want the evidence to come forward and to be very much used in policy making, but that doesn't always happen. Next slide, please. So this is broadly how policy is made. And whether or not you're at a municipal level, a provincial level, or a federal level, the process is really not substantially different. There are some elements that are different in the governance models. What I'm going to speak to is primarily going to reflect provincial policy. And I think when we think about public health, population health agendas, and how we want to influence those going forward, provincial is often going to be that early target. Having a large federal target is much more ambitious, so we're going to focus a bit on provincial. But this looks like a nice sort of logical process. There's these nice little policy stages underneath. You can see all of the influencing factors. These are very important. If you think about even how COVID has played out and the public discourse around COVID, all of these are factors that have influenced the policy decisions. Whether we like them or not, the reality is those are all the things that policymakers and elected officials are considering. So we have all these nice ideal policy stages. Then we have some evidence that we hope is coming into these policy decisions. Looks nice, neat, and tidy. It isn't. The whole public policy process is often described as being similar to making sausage. And if you know what that looks like, you can imagine that. But next slide. What in many cases it actually looks like is a bit like the old game of snakes and ladders. And so what happens in a public policy process is that often you will get this process where something really escalates. It might be a new piece of evidence, it might be something that's happened situationally, environmentally, that moves a policy conversation way up the scale. But then sometimes things happen and they start to sort of slide back down. And this actually probably is more representative of what the actual public policy process development looks like than that nice, neat, tidy, organized diagram. So next slide, what kind of questions do policymakers typically ask? When you're looking at writing a policy brief, you need to think about what is it that the policymakers are going to want to know. So they want to know what the problem is, but don't admire the problem. They likely have identified the problem as well, but they need you to be very clear on what is the problem that you're trying to offer a solution to. Why does it matter? Why is it important? And not why is it important just to you or to the research you might be doing or to the organization you might be involved with. Why does it matter to the public? Policy is all about public policy and about the public. So why is it important? Who is this going to make a difference for? What can and should be done about it? So it's one thing to say there's a problem and why it's important, but what can be done about it? And how should we go about doing something about it? How will we know when it worked? And ideally, what should we stop doing? Although this is generally a piece of conversation that happens well after an initial policy brief. So next slide, please. There's a few theories of public policy change. The key is that when you're looking at putting forward some new policy option, when you're moving a brief to try and action it, the 3 C's are critical. You must be clear, you must be concise, and you must be convincing. You want to be clear on what you want done, why it's important, and what impact will it have. Simple, straightforward. If you put too much into it, you'll actually lose the plot. So you need to keep them very focused on those key elements. And Suzanne has an interesting hot water tank analogy that she'll share as a theory of public policy change.
So this is a very simple one, and it kind of illustrates the challenges with the process Nancy has outlined. So there's a circumstance where children are getting burned by hot water tanks because the manufacturer setting is too high. And so the Injury Prevention Board approaches the Canadian Safety Council saying, should we turn down the temperature on the hot water tanks at the manufacturer to reduce the risk of child scalding? So what they want done is the temperature to be reset at a lower level. Why is it important? To reduce the likelihood that children will be scalded when using the hot water tap. And what impact would it have? Well, it will reduce the likelihood of children showing up in the emergency department for burns, which I think represents about 7% of all burn injuries in children. That's clear, concise, and hopefully convincing, but it has to be evaluated against the risk of increasing the likelihood of listeria coming out of the hot water tank if the temperature is set too low. So as Nancy said, around a saleable policy idea, it has to be relevant and it has to be achievable, but you also have to weigh the pros and cons of the impact that it will have. And I'll pass it back to Nancy.
Thanks, Suzanne. Next slide, please. So, what are some of the things that you can do if you're advocating for a change in public policy or a new public policy? And each one of these actually have a great deal attached to it. But just to give you, a few high-level bullets on this, engaging with decision makers is really critical. It's important to talk to decision makers early in your process to understand what this issue or problem means for them, what they would be looking for in some sort of solution. And so that early engagement with decision makers is critical. You don't wait until the point of writing a policy brief and submitting a policy brief to engage with your decision makers. Ideally, you try to identify some of those people within government, again, no matter what level of government you're working with, people at the staff level who understand the problem, the issue that you're dealing with, and who would be potentially interested in a solution. They can be extraordinarily helpful in helping you lay out what are the key elements you need to be putting into a policy brief to get the attention of the decision makers that are higher up the public policy decision-making frame. You need to, of course, gather the best evidence and mobilize the knowledge. This is not something that's new to any of this group. But again, mobilizing knowledge is really important, and Suzanne will touch on this a little bit later on too. You want to get as many people aware of what that new evidence is. So mobilizing knowledge and thinking about how you're doing that, again, right from the front end of your work is really important, and throughout your work, so that there's no surprises and that people actually have a sense of what this is all about. And then the third thing is to build a narrative. So a policy brief is great, but the more a policy brief can have alongside it a compelling story, or that the policy brief gives a narrative that those at a more programmatic level within the government that you're working with can actually present this information, again, further up the decision-making chain, and that those at a more senior level can actually use that narrative in telling people about why this is important. Really a core element within a policy brief and or an augmentation to a policy brief. This is particularly important in public health, where you're often dealing with really quite big issues, and people really want to understand the story that is behind this public policy issue and what that solution would look like. What's the story that that solution would look like? Engaging with the community is critical, of course, and because you're involved in thinking about public health, you know that public health is all about the community, not about the individual necessarily. And so engaging with the community is really important. And of course, looking at the development of policy options. You have an issue, you have a solution, but in all likelihood, there are multiple solutions. And some of this relates to the kind of analysis that Suzanne was alluding to in the simple hot water tank example. Be aware of all of the evidence, not just the evidence that supports your position. What are some of the other evidence points that actually could contradict what you want to do? And you have to be prepared and acknowledge those in your work. Do they need to be in the policy brief? Not necessarily. But you need to be prepared if somebody wants to discuss that brief with you, that you're prepared for any evidence that actually might speak to the contrary of what your solution might be. So those are really quick and dirty advocating for public policy activities. Next slide, please. So as I've already alluded to, there are many different levels of decision makers. You need to be clear who you're engaging with, why you're engaging with them, at what point are you doing that, and with whom. So you need to be very clear what level of decision maker you need actually to approve what you want to do. When you think about population health agendas or social determinants of health, the other thing to think about is maybe outside the box of who you would traditionally think is going to be the support group or the policy action group to enable your request. We usually automatically sort of defer to health. We'd like to see this within the health realm. But maybe there's somebody else, another ministry that isn't as busy as health, always is, even when COVID's not around. You know, is there another ministry that might take up this, this particular policy position and could help champion it and lead it? There might be multiples. One of the examples that Suzanne and I talked about when we were thinking about our presentation is the fetal alcohol syndrome spectrum disorder. Some of the champions actually came from very different ministries and a particular minister. It came through Children's Services initially. It was not through health. It really was through Children's Services. It got picked up in other ministries where it was of interest, even in immigration, in education. And so you need to think about, you know, is there somebody else within this public policy arena that you might actually want to target as the person you're engaging with? So be very clear when you're preparing a brief, who you're engaging it for, what is their agenda, and you might want to get creative, but you're not going to send exactly, in all likelihood, you're not going to send the same wording in a brief to a health decision maker as you might say somebody in community and social services or somebody in education. There's going to be some varied elements. So next slide, please. If we think about briefing notes, I mean, briefing notes are something that happen at all levels of government as well. So staff prepare briefing notes for their minister, for the deputy minister, and for those of you who aren't familiar with government, provincial government design and federal, the deputy minister is the highest public servant, or an assistant deputy minister. And often assistant deputy ministers are making these kinds of policy decisions, or at least preparing them for a ministerial decision. So briefing notes are always done before there's a meeting with any of these senior people, elected or unelected. So the briefing note prepares them for the meeting. They might be used in question period if the minister is actually taking something forward to elected colleagues. And certainly a briefing note is needed if there is ever a decision. So briefing notes are used at various places along the way. These are prepared by the staff. And next slide, please. And they always contain, and this will look familiar to any of you that have done policy briefs, because it's typically what we look at in briefs and what the O'Brien Institute uses as parameters for briefs as well. They're looking for a very brief summary, what the issue is, a bit of background, and this is a bit of background, again, not admiring the problem. What are some of the considerations and what are the recommendations? Very clear, very concise. These are typically max 2 pages. So when we talk about the 3 C's, concise is really important. That's a lot of information to get into 2 pages. Does this mean that your briefs have to be 2 pages long? Not necessarily. If you're sending this information to somebody who's at more the program level within the ministry, your brief could be longer. But ultimately, you want to be very clear around what are the highlight points that you might want them to pull forward into a very short brief that they might present to a minister. Or that you might want to prepare this also shorter 2-page brief if you manage to get a meeting with a deputy, an assistant deputy, or a minister. So those that are at the program level are interested in a bit more material. You can provide them with a bit more information in a briefing. But ultimately, when you're getting to decision, you're looking at finding the highlights within a 2-page document. So you have to be very tight. Next slide, please. So a saleable policy idea, and Suzanne touched on a couple of these in the example, needs to be substantive. It needs to be relevant, not just relevant from an academic interest or from a very narrow interest perspective. It needs to be relevant broadly. It needs to be built on evidence, ideally both the problem and the solution. And if your solution doesn't have a lot of evidence around it, what is the sort of foundational evidence that you used in developing those recommendations and those solutions? What was the framing, the evidence framing that you've used? But don't oversell a solution if you don't have evidence around the solution, because part of what you might be asking for is actually to test or pilot a concept and develop an evaluation or research piece around it. Again, to be relevant, it needs to serve the broad public interest. If it's municipal politicians, what's it going to do for their city? If it's provincial, what's it going to do for the province? Federal, what's it going to do for Canadians broadly? So does it serve the broad public interest? It needs to be communicable and achievable, and the values need to align with government. So you need to know what are the things that government is interested in. You need to use some of that language in the development of your briefing. Case in point, the example that you're going to discuss in about 2 seconds, because I'm basically done on my last slide, our natural supports work. Partway through our project, government decided that they had an interest in civil society and they wanted to focus on civil society. Well, what does it take to be a civil society? One of the things is you need to have people with a sense of connection, social connections within their community. That's part of what underpins civil society. So we shifted some of our language and actually talked about civil society, how naturally supportive communities were consistent with the civil society agenda. Did we walk down some government road to do that and not be true to our evidence and our belief? No, absolutely not. But what we did do was we looked for where within government direction were there some hooks that we could hang our work onto so that they could see how what we're doing aligns with what they're doing and could create that broader shared benefit. The last comment here is beware of the anecdote. I said we always hope evidence will reign supreme. What we know is that more often than not, if you don't do a really good job of presenting a brief, presenting a concept and a solution that is evidence-based, the anecdote, sadly, will reign supreme. Around many issues, government has to make decisions sometimes. They have no choice. If they don't have the evidence, if they don't have somebody that they feel and that they trust they can use for advice to develop a solution, the anecdote can reign supreme. You want your narrative based on good evidence to influence policy going forward. And with that, over to Sue.
And I'm just going to jump in and build on Nancy's beware the anecdote, because I have spent a good part of my career trying to think about why this matters so much to us in our research program. And what I've come to understand is that even the best thinker translates information into something that they can relate to. And that's why Nancy has emphasized so much the value of the narrative. And so your decision maker could be hearing just as compelling a story from their next door neighbor or from their cab driver, as you have tried to present with the evidence. And so I think it really is important for us to realize that that's how the brain works. That's how we make what we see in our world relevant to our own self, our own family, our own community. And so we could have a whole workshop on how to help address the challenges of the anecdote, but how also to spend time in your own area of interest, building the narrative that can be just as compelling and evidence-informed. And so with that, we'll go to the next slide. So there was this sample brief that we prepared for O'Brien, sent out prior to the workshop that we're having today. And I'm not sure how many people have had a chance to actually read both the brief one and the lengthy one. So I'll spend a couple of moments highlighting some of the key points. I can't see how to ask how many people have read it, but I think it's still probably worthwhile highlighting a few areas that we found to be important. The purpose of our policy brief was to highlight the need to build naturally supportive communities to promote well-being, as Nancy has already suggested. This builds on the initiative of contributing to civil society, but also underpinning our policy fellowship was a real desire to really think hard about upstream preventive approaches that could reduce the likelihood of children and families experiencing difficulty that would ultimately reduce the burden on tertiary care systems to address families and youth in need. So next slide, please. Because natural supports may or may not be familiar to everybody here, this is just a brief highlight of what we used as a definition. And that's another thing to think about in terms of preparing your own policy brief, is to try to create a common understanding of the words that you're using. And so natural supports are informal give and take social interactions that promote success because they build up our sense of well-being and make more available energetic resources for problem solving. So an analogy that I've used before, some of you may have heard, is you've got so many pennies to spend between now and the end of your school day or the end of your work day. If you have to spend all of those resources bickering with the bus driver or the barista, you've got nothing left when you have a real problem. And so we were really interested in how we could encourage communities to have approaches that would enhance naturally supportive behaviors and naturally supportive environments. Now, Nancy talked about the relevance of the evidence, and of course, or not of course, but for our area of interest, we have built most of our evidence on a combination of brain science at the individual level and on reports about communities that have had successful initiatives that have improved well-being in their jurisdiction. One of the pieces of data that we have used to capture the imagination of policy and decision makers is in the context of reminding people of how important adults are in the lives of children, is some actual data that suggests that almost 30% of children have reported at the grade 4 level that they have no important adult in their lives. And so this piece of data can be used to connect to a number of decision makers. First off, children with no important adults are less likely to do well at school, and they're less likely to become the taxpayer of the future. That's important to some ministries. Children that have no important adults in their lives may be more likely to have mental health concerns and therefore require more services in health. And I'll move forward, but you get the idea of finding something that you can generalize across audiences. So the next slide, please, around why we were so interested in communities. And part of this is our passion and understanding that really the communities that we live in provide the backbone of our society. And so we wanted to highlight that communities are important to support local residents, enhance safety, enhance security, and a sense of belonging. And I have to smile because many of you in this area of work will realize that as public health researchers or as epidemiologists or as social scientists, we spend a lot of time quantifying the value of common sense and quantifying how important these things are in order to move the needle towards, in our passion and in our area, healthier and safer and better communities. So if I'm saying anything on here that you think, well, I've never heard of that before, then that's probably a bit of a red flag. So we'll move on. So these are components of our policy brief, and in the next slide, you'll see how we highlighted specific actions that people can do to create more naturally supportive communities. Next slide, please. And the reason we do this is so that people have examples of the solution. So Nancy said, do not, I forget your word, Nancy, but do not get so enmeshed in the problem that people forget that you're trying to find a solution to it. And sometimes what you need are a few examples to get people thinking about what it would look like if they actually embraced your idea for a policy change or for a change in how they implemented their programs. And so we use this opportunity to give concrete examples, and actually created a whole workshop about what this could look like to help people really get a sense of why we were focusing on natural supports. And I'll just pause here to say that one of the things that we felt we needed to do was to remind people that we were not trying to encourage the development of more programs that meet the needs of families and youth that are already vulnerable as a consequence of circumstances or experience. What we wanted to do was back it way up to the citizen engagement piece to then potentially prevent some of the challenges that children and youth and families might face in their neighborhoods or their schools. So this was a piece of work that took quite a bit of time, because one of the challenges we faced is that most people that are interested in children and youth have a lot of experience working with those who are vulnerable. And the idea of moving out of a programmatic role to a more population-based, natural supportive or community engagement role took a little bit of work for us. So what? So now let's move on to some of the questions that we thought would be interesting to maybe wrestle with today on the next slide. And we'll talk a little bit about this in relationship to our policy brief. And if you did read it, I'm going to refer specifically to the material on pages 3, 4, and 5. But these are questions that you can look at in your own work to consider whether or not you are making it easy for the policymaker to do what you believe to be the right thing with the best possible evidence. And so how do you pick out the salient messages to make the narrative align with the evidence? We did this in our policy brief by framing it around why should we focus on communities? And we talked about the asset base that communities have. We talked about focusing on what works and how it would work. And then we made sure that we told our decision makers what we believe the outcome would be based on what we knew about the evidence to date, without overstating the evidence, because communities are complex creatures, really. And one of the things, this is a bit of an aside, is that we have to be aware of is you cannot suggest that there's a causal relationship between the change in policy and a change in behavior. It's much more complicated than that, but that's a different conversation. We also wanted to make sure we had some of the key pieces that could be consistent, as I mentioned before, across different readership or different audiences or different jurisdictions. This is something that is really critical in terms of a broad policy agenda, is creating the common language that everybody can identify with. And it's worth spending a fair amount of time on. And that was something that we believed to be important and did spend some time on. What are the key points that may be important across ministries? We focused this around what is the current opportunity, and we based it partly in some of the COVID experience, because there was no point ignoring that COVID was part of the environment as this policy fellowship unfolded. And so we actually had access to some data around how COVID was impacting the lives of families, youth, and children. And we used that as part of the key narrative to remind our decision makers and program people that this is important to all of the people in our neighborhoods. And then how did we frame the summary, or how was the summary framed? We framed this around the current policy climate. And Nancy talked a lot about how it needs to align with the values of the decision makers. And it has to be something that can be anchored in work that is already of value or of relevance. And I would love to talk more about any of this, and hopefully we'll have some time at the end. And then there's a couple of phrases that have really guided me in doing this work. And I'll just pause for a minute and share one thing I always ask, and if any of my team or trainees are on the meeting today, they'll know that one of my most important phrases is to just say, well, so what? Like, and not in a superficial way, but so what? Why does it matter that 30% of children don't have an important adult? And if I don't know, if I can't answer that question, I'm hard pressed to convince somebody to make a change in either the allocation of resources or in their thinking around why my issue is important. And another thing that I've learned as a researcher, and many of you know I'm a quantitative researcher, so I have a fair amount of attraction to the numbers, is that really my job is to tell my audience what they need to know about the issue, not everything that I know, because I've had the luxury of being able to focus on a content area of interest, whereas many of my decision makers have a broad array of content areas that they're juggling all the time in their work. And so they need to know the most important things to keep what I believe to be, or what we believe from the evidence to be, an important next step. And this is often a place where I think researchers can get lost. And then as we become more lost in the data, we are more at risk of losing our audience. And Nancy, you should be nodding here because it really is something that I think we need to take to heart. And just in saying this, it's also that we do not alter the evidence to align with the decision that has already been made, but we do shape or interpret the evidence in a way that it's useful for the audience. So I think with that, we'll move on to the slide that talks about, once you've accomplished all of this, what are the mechanisms for translating it into something that can change behavior, can change policies, or change programs. And some of the tools that Nancy and I have found to be particularly effective in contemporary society is the use of the infographic. The infographic is easy to understand, and it's a bit like a policy brief in a one-page nutshell. Often your infographic can have more information included on it than is necessary, but it should also always be easy to understand. We try to find translation vehicles that are relatable and that really address some of the issues that we know our stakeholders are wrestling with. An example of that would be, it's become very clear over the past 18 months that contemporary society is focused on diversity, inclusion, equity, and other strategies that make our communities more available to everybody. And so if your work aligns with something that is a problem they already have, you want to be the solution to their problem. And know your audience, and that's not new. Many of you have given a number of presentations, and I'm sure one of the first things you ask before you prepare is, who am I speaking with? Because some of what I've said today is not how I would present our academic work, and it wouldn't be appropriate to do it that way. So know your audience. And I think we can take a look at the next slide, which is what we look for when we believe we're moving towards success. And I think one of the things that you have to be aware of, or that I've learned to be aware of in this world, is that this is a long-term project, and that success it's rarely the snakes and ladders where you get to square 7 and you get the ladder all the way up to square 92. It's more often a back and forth process. And I've heard one of the decision makers that I've worked with, in addition to Nancy, over a number of years, say, you should always have it in your back pocket, because you don't know if the issue is going to be important this year or next year or 5 years from now, but you should know always what you'd like to see happen based on the evidence and your area of expertise, should the opportunity present itself. So success will look like policymakers taking account of new knowledge to modify their priorities and agendas. Policymakers can consider different ways of tackling persistent issues and those being brought to their attention, and looking for ways to address them that might be novel or might be contemporary, that align with what society is trying to achieve in the moment. So the reason that it's so important to build these relationships early on is because ultimately the evidence decision maker partnership is built on trust. And the vision would be that many of us would become the go-to person in these content areas when our decision makers were uncertain of the best way to tackle a complicated problem. And like any relationship that we have, trust takes a little bit of time. One of the other observations that I'll offer is that sometimes it's important or helpful to be willing to flex your style to address a problem that matters to them that you might not have thought of as top of mind for you. And again, that's part of becoming the go-to person and understanding the competing pressures and demands on your policy or decision makers' time, and how you can potentially be of service to their broader agenda. So I think we were aiming for 4 minutes less time than this for more questions, but I think I'll just move to the next slide and to our acknowledgements, and just really appreciate all the support that Nancy and I have had to do this work. And really, we've been working together for more than a decade now, and really have benefited from having different viewpoints on the same issue. So another closing comment would be, it's always great to have diverse ideas on your team and diverse backgrounds. I'll send it back to our host. Thank you very much.
Thank you both of you. That was wonderful. There are some questions that have already surfaced in the Q&A section, and I received some as well. So we'll start working through those. And I'm going to focus on the questions that are about policy brief writing, and then more specific questions that are about the research could perhaps go offline, or we can do those at the end. So the first question I see here that's on brief writing is, it's important to acknowledge the opposite side of a policy recommendation as evidence and proponents. Is there a magical balance between respecting versus refuting oppositive position? And does diplomacy always win out, or do you sometimes have to be a bit harsher than you'd normally like to be as an academic, make a few enemies, et cetera, in order to be effective?
I'll maybe just start with that, and Suzanne can come in. I mean, this is why the relationship piece is so important, right? If you have a relationship and if you're a go-to person, then sometimes you can take a much more firm stance and really be much clearer in the fact that, this really needs to be this way. We're not very comfortable with this over here, and this is why. So that relationship piece really does need to underpin that. I think, you have to be true to yourself at the end of the day. There will be times when there are very beneficial policy decisions that could be made that won't get made because of political factors. What you really do want to do, though, is ensure that if there's something that you think is really going to create an issue, a problem, take it in a very different direction, you do need to be clear, and you need to offer that concern, fairly clearly, and just say, these are what I think are the issues. You're always talking about the evidence. You're not talking about people or person's ideas. It really is about the evidence. So what does the evidence say? What works? What doesn't work? And what might concern you? We've actually had an example of some work that's been done related to the natural supports work that we don't feel the evidence was good around it. And so we have said a few things. We haven't been overt because at this point, nobody's picked it up in a big way. But at some point, we may have to actually speak to that fairly directly. And we would if we had to, because we feel that the work could be better and could be detrimental as it is.
And I think connecting to a question that I received was, it's sort of almost asking how much sauce can you put on things, right? So an academic will speak in a certain way and style that's different than the way other policy lobbyists or advocates might speak. And is that disadvantaging the academic in that setting, or does it actually give them longer term credibility? And so I guess I almost sense that that's part of the question, is how much sauce should you put on it? What are the consequences of that sauce?
Yeah, I would say that it depends a great deal on, again, on whether you have a relationship or not. And if you don't, I mean, if this is something you're coming in cold on, then you really need to be a bit more careful and then work to try and build more of that dialogue going forward. Try and open the door to, or open the thinking is maybe more the way to put it. And that's likely to be your better end. Are academics disadvantaged in these conversations? Sometimes they can be, to be really honest, because the language is not always as accessible. And that's why it's important to really get your concepts simple, try and get your language readily understandable. You know, if you say it to your neighbor next door who's, say, a bus driver or something, not in academia, does it make sense to them? Does it make sense to your children? If it doesn't make sense to those audiences, then you're going to have a problem in talking to the policymakers. They look for that simple, easy to understand language. So not so much the content needs to change, it's more the language needs to change to illustrate the content.
Yeah, I was just going to say, I'm not quite sure what the word sauce means in this question, but the first thought that came to mind is, as academics, you've got to ditch the jargon. It just creates a place of separation between you and the issue you're trying to talk about. And so, so I think we can just surrender that we all have different areas of interest. And so I don't really need to understand how my car engine works to trust my mechanic. And he's found a way to explain to me what I need to do to fix my car. That means I trust him. And so I just think that that's been something that I've learned.
Perfect, thank you. So Hussein is asking, Nancy mentioned about the initial evidence. What if the idea is about an innovation that has not been tested or evaluated before?
Yeah, so again, and Suzanne can jump in on this one. So, and of course, innovation is huge these days, right? And everybody's looking for it. So, I think if again, you want to look at having some evidence that underpins what you're recommending. So the evidence may not speak to your solution, but it at least underpins your thinking. So framing within the evidence. So Suzanne gave the example in our project where we framed it, it was underpinned by the brain science. And I would say part of that brain science was also looking at, not exclusively, but there was a lot of focus at the time around adverse childhood experiences. We know ACEs is sort of one of those things that was out there. And what we talked about was, we know the evidence around that, but this is something about getting upstream, trying to prevent proactive supports for ACEs. So the foundation was evidence-based, There was much more than that, obviously, resilience literature, blah, blah, blah. But was there a lot of specificity around natural supports? No. So we had to build some evidence. And you just have to be really honest and straightforward about what you know and don't know. And if it's innovation, how are you going to determine how it's going to work? What's your process going to be? Not to do something for 4 years and then go, oh, it didn't work. You know, looking at processes whereby you're doing a regular building of the evidence, building your learning to be able to give policymakers something they can actually make a decision about when that sort of early innovation testing is done. Suzanne?
Yeah, I totally agree and couldn't have said it better. I guess the one thing that I would add is it's important when you have innovation to have at least mapped out what you think not only the first order consequences are, but what the second order consequences are. Because especially in public health or in lots of these big initiatives, unintended consequences also need to be considered as we move forward in our solution-oriented thinking. So I'll just...
That's perfect. I think it bridges to another question, which is, it's almost, how do you know what your reader needs to know? So obviously you need to have a relationship with them, but let's say you have a relationship with that one individual, but not with the rest of the team or with those to whom that person will be reporting that brief to. And it requires a philosophical shift in thinking, or it requires some, you know, a different sort of concept to be understood. And so how do you target and how do you write a brief that perhaps maybe less tactical and more concept-based or more problem-defining? I think that sort of differentiates from, I think, the way we've been talking about these briefs so far.
Yeah, well, I think this is where it's just important to understand who that audience is and where their priorities and issues are at the time. Suzanne used that illustration of, this is one thing that you know a great deal about. Even the person at the program level might know a great deal about it. But once you get up to the level of an ADM or a deputy minister, they have 500, 1,000 other files. And so is there something in what their current priorities are that this relates to that could be helpful in making some of that connection? And how do you bring those pieces together? And so it requires a bit of an ongoing environmental scanning of what it is that's happening at the level of government, and having that person maybe at the lower levels of government to say, how should I approach this? What is going to play? What are they going to hear? And then you can decide if what that is actually fits with what you want to do, or if you need to just pull back and come back at it at another time, because advancing it might mean you have to shift direction too much to really have fidelity to what it is you want to do.
And I would just add on that, and you can refine this, Nancy, but my understanding is almost every ministry has a mandate letter, which outlines what they're to be accountable for in the next upcoming number of months. And so if you know what the mandate of your decision maker's portfolio is, it gives you a bit of an idea of how you can see where your key area would be of priority to them now or in the future. And the other place, not to discount the communication, is public media. I mean, many of our decision makers are very up to date on what's happening in contemporary society, and that's where they're getting a lot of their information from.
One of my standard lines is, when it comes to public policy and influencing that, timing is everything, and timing is dependent on knowing what's going on, right, and paying attention to what's going on. In addition to the mandate letters, the government business plans, they're all up on websites, very easy to find, and you can dig through those and see whether there's outcomes, strategic thrusts, whatever, that relate to your agenda.
Great. And I think last question, then we'll close it out. I know we have a hard stop before 1. People who want to make really beautiful infographics, like that are in your policy memo. So how and where do people do that? To make them look really nice, and not everyone has designers on their team. So what do you suggest?
We certainly
Get
didn't have
somebody
designers,
young.
but we had young people who were really good at doing this kind of stuff, not us. So, you know, we certainly looked at very much at the content, what were the elements that we wanted to have there. And, but no, we had no designers. This was done by, actually in part enabled by one of the team members in the Burns Memorial Fund, and then some of our really great academic supports that we had as part of our project, but young and able to play with the technology in a way that certainly I can't do, and I would say not Suzanne's area of expertise either. So you can find people, you don't necessarily have to pay designers. Again, if you're clear about your information and then, you know, they present it, test it with some people, give it to them. We did a lot of testing with people to say, what does this say to you? What do you pick up out of this, right? Make those changes. So it really became, it's a bit of a collective effort, I would say, the best way to do it.
Perfect. So, and then I'll just answer Kara's question about the policy brief writing, so competition. So I'm sure there'll be others. The current one that you're referring to is closed, but I'm sure there'll be others. And I think part of why we wanted to have this memo writing, policy brief writing workshop is so that we are scaled up and able to do this again. So look forward to that. And Leslie, we'll pass on your question to, I think it was directed more Dr. Tuff. So we'll pass it on to Dr. Tuff, and then she can comment on the specific research content as well. Thank you everybody for coming. Thank you to our esteemed presenters for your endless generosity and knowledge. We're grateful and hope everyone has a great rest of the day and weekend. Thank you so much.
Thank you for the opportunity.
Thank you very much. It was a wonderful opportunity. I just popped in the last answer in the chat box, so I think we are complete.